Hi everybody, Dr. breannekallonen, naturopathic and functional medicine doctor. In this video, we are going to go through the before and after labs of a patient who has lost 30 pounds going through the metabolic reset program. So this individual started at 215.5 pounds and has lost 30 pounds in the 6 weeks. The ending weight was 285.5. And then as you can see here on the graph, they are maintaining this weight loss. So let's go through what did the lab say before the reset program and what did the lab say after. So let's pull up the pre-labs here. Yes, you can see my screen. I'm going to make myself smaller. So as a functional medicine doctor, I like to be objective and look at blood work before and after to ensure that we are on the right track. So this patient came in, and as you can see, first and foremost here, the testosterone levels are low. I like to see testosterone anywhere from 700 to 1250, and less than 500, I believe, should be considered deficient. The reference ranges for testosterone over the years are going low and low and low and lower. So the labs are just changing the range. So individuals 10 years ago that would be classified as deficient are now classified as being normal. And I don't believe this is okay. And it's definitely not optional. So this patient had some room to go with respect to the testosterone. The free testosterone was not too bad, which was great to see. Estradiol. So men do require optimal levels of estradiol. There was a study published in JAMA that showed that men who were at the highest level of estradiol, as well as the lowest levels of estradiol, were at an increased chance of overall mortality or death. So we do want estradiol to be in the sweet spot for males. Anywhere from 21 to 30 is where we would ideally like to see it. Hemoglobin A1c. This tells us on average over the last 3 months, how is this patient managing its blood sugar? It does not tell us how hard the body is having to work or how much insulin is the body having to produce to keep it under control. If you are new to insulin resistance, I would highly recommend that you check out my other video on insulin resistance, which I will link below so you can fully understand this. So on average, the blood sugar was 5.9. This does put the patient into the pre-diabetes category. So they do have insulin resistance that we want to address. Interestingly enough, when insulin resistance is present, we often see that associated with lower levels of testosterone. And correcting the insulin resistance can improve testosterone levels, which we will see on the post-lab workup. Lipid panel. This patient does have elevated levels of cholesterol, just slightly above the normal range. HDL is the good cholesterol. We want this to be high. They are running low, which is not optimal. We are also seeing the LDL or bad cholesterol be a little bit on the higher side. So this is something that we want to improve on as well. Now, this patient had their labs run by their medical doctor. So a fasting insulin was not run. If you've checked out my other videos, you know that I always like to run a fasting insulin and comprehensive testing. If you want to run your own blood work and you want to have these things checked for, you can use my Rupa Health link. You can either do the insulin resistance, leptin resistance panel to get a good idea of how your blood sugar is doing, or you can do the comprehensive panel. There's one for males or one for females. It looks at everything from your hormones to your blood sugar to your thyroid, etc. Now, if you do have a cholesterol panel, and you're wondering if you have insulin resistance, you can use this website, thebloodcode.com, which I'll link as well, to plug in your triglyceride levels and your HDL to get an idea of what's going on. I don't like the triglyceride HDL ratio to be above 1. So I don't think this is necessarily optimal to go above 2, but if you are less than 1, that is fantastic. So when we plugged in this individual's triglycerides and HDL, it was 3.5, which is showing significant insulin resistance. Some individuals, unfortunately, if they are pre-diabetic, they're not giving any guidance in terms of how to fix it. What is the solution? They're just told, hey, you're pre-diabetic, go home, lose some weight. This is not helpful. There are key strategies that we need to implement to prevent diabetes, type 2 diabetes, from developing in the future. So this individual did the metabolic reset program. There's nothing fancy with it. It is whole foods nutrition. We guide you through how to properly eat, what your food choices should be. We look at sleep and mindset and your hormones. There are supplementation involved. There's no medications involved in the program. So what you can see is this individual has completely changed their health trajectory in just the 6 weeks time without the use of testosterone replacement therapy, which is unbelievable to see the testosterone go up. So let's do the post labs now to see what has happened. So again, 30 pounds down in a short period of time. This is what we saw. So let's go up here. Testosterone level has increased to 594, which is amazing. Not everybody do we see this significant of an increase in the testosterone levels, but this is very impressive without testosterone replacement therapy. Yes, the optimal is 700, but this individual is well on their way. This could improve over time, as well as we may want to consider something like an ashwagandha or a fenugreek that can also support testosterone levels, or maybe even some resistance training. So this patient has done an amazing job. Insulin levels. We did monitor the insulin on the follow-up lab. 7.8 is fine. I see optimal insulin anywhere, like I want it more around a 4.0. So for this patient in the maintenance phase, to prevent the weight from coming back, we still need to do something to sustain the insulin resistance. Perhaps this individual just has a genetic predisposition. So what we want to do is look at, could we use something like a berberine to help sustain it? The cholesterol panel, this has been a huge improvement as well. The total cholesterol has come down. It was just over that 200 range. It's now at 163, which is great. Triglycerides have significantly come down. The HDL is still a little bit low here, so we may want to consider adding on a fish oil at this point in time. The LDL is a little bit high. A fish oil may help with this, but so can berberine, and so can the proclomannan fiber that is in the fiberline. So we'd have this patient continue with that, as well as really emphasize a ton of vegetables in their diet. That will improve over time. I'm confident with that. In terms of the hemoglobin A1c, remember this patient was 5.9, putting him in the prediabetes category. And just a short period of time, they are now at 5.4, which they've been removed from that risk category, which is amazing. I like to see a hemoglobin A1c always below 5.5. So this patient is doing a fantastic job. And over time, with the maintenance plan that we have this patient on, I'm confident that this is going to stay, or it's going to go down as long as this patient continues with the lifestyle choices. Now, the Metabolic Reset Program is a 6-week intentional program to result in weight loss, but the focus is not necessarily weight. It's correcting the underlying issues for this patient, the insulin resistance and the low testosterone, so that weight can come off. Most importantly, this individual is feeling better, more energized, food cravings is gone, mental health is better, which is absolutely our goal. Treat the underlying problem, and then weight comes off as a side effect. Now, after the 6-week losing phase, there's a very important mandatory 4-week maintenance phase where we start to reincorporate foods. We teach you how to maintain it. This is not a glamorous phase. You know, everybody is so focused on lose, lose, lose. We don't focus enough on maintenance. So this is why it's even more important to go through this maintenance phase so we can teach you what it is like to create a sustainable, healthy lifestyle, and it gives a break on your thyroid gland because losing weight is a stress on the body. So patients will cycle between the losing phase and the maintenance phase and the losing phase and the maintenance phase if they so choose. Or by the end of the maintenance phase, you have created a sustainable, realistic lifestyle plan that feels flexible and is specific to you. So I hope that was helpful in giving you insight on what is possible in a short period of time. If you have insulin resistance, prediabetes, just know it is absolutely reversible with the support of diet and lifestyle and mindset and sleep, and it doesn't have to be overwhelming. We can keep it really simple and help you obtain your results. So I hope that was helpful. Talk soon.